You've heard about peanut immunotherapy and maybe even seen those viral videos of kids eating a peanut for the first time. But what is food immunotherapy? How does it actually work? And what's the deal with swallowing drops under your tongue instead of eating those tiny doses of allergens? Today, we are tackling and talking about OIT versus SLIT, two cutting edge treatments for food allergies that could literally change your child's life. But they're not one size fits all. We'll break down the differences, who they're best for, and what to consider when deciding if either option is the right next step for your family. So, yeah, Dr. Meagan, can you just share a little bit about what is IT? In food IT.
Yeah, so immunotherapy in general, we'll just kind of start with that. And the goal with immunotherapy at its basis is that we're trying to teach the immune system to recognize things in a non-inflammatory way. And typically it's something that your body recognizes as an allergen through repeated exposure or particular specific types of exposure. We can get your immune system to recognize that in a more safe, normal way. And there are different types that are done for environmental allergens. We also do it now for foods, which is of course, subject of what we're talking about today. But it's such a big deal because there's so much food allergy out there now. So for a long time, what we had talked about in the past with food immunotherapy was something that we call OIT, and that stands for Oral Immunotherapy. And so that is referring to a type of immunotherapy where you are given the food in some type of form. And Dr. Patterson is going to get into the nitty gritty of this, but you basically swallow it. So it's a pretty simple process by words. In reality, it requires a lot more detail. For SLIT, that stands for Sublingual Immunotherapy, or SLIT. And so that is where you put drops under the tongue. We have immune cells there that can absorb that and take those antigens into the immune system, where it tries to teach your body to recognize it again in a non-inflammatory, safe way. So those are the differences between OIT and SLIT. And so I'm going to turn the platform over to Dr. Patterson to talk more about it.
That was a great high-level summary. Many people have heard of OIT since a couple of years ago. There was the first FDA-approved oral immunotherapy for peanut that came on the market. Many allergists, under some common protocols that had been published, had been practicing OIT for a long time before that, for more than just peanut. But this was a big deal when that was FDA-approved because it gave a standardized dosing availability for maybe allergists who weren't already doing OIT to finally have a way to offer this to their patients. So like Meagan said, the OIT is where you're ingesting actual food particles into your mouth, swallowing it, kind of like that normal eating process almost, but starting with really, really small amounts. I mean, we're talking not quite microscopic, but almost, and at a level that even people with the most severe food allergy can usually tolerate, and then gradually working way up. Whereas SLIT is the drops of the purified protein extract under the tongue that gets absorbed into the lymphatic system. And so it's two different approaches. And I offer both in my practice, and oftentimes parents who come interested in immunotherapy for food want to know, okay, well, which one, we want to do something. We don't just want to avoid the food. We want to get to a better place with this food allergy. And they usually have two questions. They want to know, which one do you recommend for my child, OIT or SLIT? And they want to know what they can expect on the outcome of the treatment. And so first step is I like to flip the conversation and say, well, you tell me what you want to get out of this, because some patients, like classic example, teenager who has been told their whole life that they could die if they ingest a certain food, even if all their testing is telling us that that sensitization has decreased to a point where they could try the food even like outside of immunotherapy, talking about an oral challenge. A lot of times they'll say, no, I don't like it. I don't like the smell. I don't ever want to try it. So that may be somebody who maybe they had some accidental ingestions, landed in the ER a few times, and now we're talking about immunotherapy for bite safety. So to get them to a place where if they accidentally eat something, they're not going to end up in the hospital like they've been. So bite safety is one goal that some patients have. Other patients want to completely reintroduce the food into their diet. They may say, I have always wanted to try a peanut butter and jelly sandwich. I want to be able to pack that in my lunch. So I try to get really specific on what their end goal is. And that can change, and it can be different between the child and the parent too. If the patient is a child, sometimes it's the parent really pushing because they want that freedom for their child, but maybe the child doesn't, or vice versa. So anyways, step one is figure out what the patient actually wants, because that can help guide your decision. And then for deciding which one to choose, there's also a few factors that go into that. So there's, what is your history? What do your tests show? I usually get skin testing and blood testing, have, both things to compare. Different allergists do it different ways. Some will just use one or the other. Some will use component testing with lab testing. But basically taking the history, the blood testing, the skin testing, the patient's goals, that's how we make a decision. Do we proceed with OIT or SLIT? And in general, just kind of high level, hypothetically speaking, I would say that OIT tends to be great for people who want a more aggressive approach. It's a little bit stronger, might get you to where you want to be faster, but there's also higher risk of reaction with that. The SLIT, lower risk of reaction, little more gentle approach, may take a little bit longer to get us where we're going, but both have been successful. And again, these are non-FDA approved off-label treatments we're talking about, except for the one peanut OIT, but both have been successful in getting patients clinically to where they want to be in terms of being able to be around a food, be bite safe with a food, and or reach what we call sustained non-responsiveness, where you basically outgrow the allergy and can add it into your diet.
I wonder what your experience has been kind of with, I think one of the fears that I've had in regards to offering OIT in particular, one, just knowing I'm a brand new practice, I need some infrastructure to help support these patients and their families, and helping them feel safe, as safe as we can, with something that inherently has some risk. Are you hearing and seeing like a lot of side effects, like tummy aches and those sorts of things that we hear about or read about in the papers?
Mm-hmm. Yeah, with OIT, it is, the common side effects are typically GI, upset tummy, sometimes some mouth symptoms. And so those are things, if patients are experiencing those, that we've already given them some guidance on ways that they can manage that. But, if they've done an up dose and those symptoms are being persistent, not resolving with treatment, then we have to take a step back, maybe adjust down their dose, do a little bit longer at a lower dose, and then move up. Just like with other forms of immunotherapy that we do, sometimes there's a little bit of adjustment along the way to getting someone to tolerate their immunotherapy. And so it's a really personalized approach.
Awesome.
I think one other thing too, just to mention differences between the two that can impact your decision a little bit, because it has to do with how many visits are required to get going. So OIT, there's usually an escalation day initially where you're in the office for hours, starting with that little dose working. Have you guys had patients that asked about these therapies? Do you feel like it's something parents are wanting?
Absolutely. Yeah, I think it's been on my radar as something I would love for the Immune Confident Institute to grow into. Part of my issue, one, we just started like a few months ago, and so need some help in getting the bandwidth to offer a treatment like that. But we also will need a space to see patients because primarily while we're recording this, things are more telehealth based than anything. So having that physical space to be able to do these updosing visits and in sessions, I think will be critical as I think about the growth and expansion of what we're able to offer our patients. I wonder too, I know we've always, and this is going out on a little bit of a limb and me just kind of hypothesizing, but for my patients with mast cell disorders, I do wonder, many of them have symptoms that sure as heck look and sound and act and feel like true allergic reactions to foods, but their skin prick testing is negative or their serum IgE testing is negative. And so I asked this question more just to ask it, not that I'm planning on doing anything about it at this moment, but is there potentially a role for very small increased dose, to try to desensitize the mast cells to whatever it is they're reacting to? I don't know, but there are some other things that we do that for. A lot of the patients that I see, there tends to be a latex food, so there are certain foods, mostly plant-based foods, that all share protein structures that are somewhat similar. And so sometimes the immune system can get a little confused and mistake birch tree pollen for apple protein, for almond protein. And for instance, with apple, if you peel and cook the apple, oftentimes it's no longer an issue. But those proteins that show up time and time again, those oftentimes are ones that you can kind of connect some of the foods these patients are reacting to back to some of those elements. And so it does kind of give me this question of like, is there a way to work around that? I think that's what we have here on, the beginnings of food allergy treatment. I am sure that this conversation is just going to spark additional questions, thoughts, concerns. Is this allergy actually? We want to hear all of it in the comments. Make sure to ring the bell, to follow us. We don't have that spiel down, but we do want to get this message out. And certainly if you are, interested in connecting with allergists who are on the front line, who are really active and engaged in innovation and really taking great care of patients, make sure to check out the Ani Allergy Learning Network and connect with someone who is engaged in your local area. Until next time, this is
Allergy Actually.